Hi guys, it's Nurse Amy here.
And Nurse Carm.
And welcome to the Medical Mission, where you'll find anything and everything medical related. So the topic of today's video is going to be pain management at home after vaginal delivery or cesarean. Many of our patients ask us, do I continue taking the medications that you guys have been giving me, or do I stop them? So if you had an underlying condition such as preeclampsia or maybe anemia, of course you will continue taking your medications, but your doctor or nurse will talk to you about this. For pain medication, it's different. You'll only take pain medication as needed. So you'll usually take pain medication or relief measures when you need it versus around the clock. Acetaminophen. It's the most commonly used pain medication in every healthcare institution. Acetaminophen is a generic brand name, and Tylenol is a fancy brand name that you guys probably know it by. They are the exact same thing, so don't get caught up with the beautiful pictures and colors and fancy logo. It's the exact same thing, guys. In the hospital, we usually ask patients to range their pain on a pain scale of 0 to 10. So with 0 being no pain at all and 10 being excruciating pain. You would take Tylenol if your pain ranges from about a 0 to 5, so mild to moderate pain. Tylenol is good for any pain in general, so it could be incisional pain from your C-section, vaginal pain, if you have a tear, if you got an episiotomy, or even if you have hemorrhoids. It's good for any pain, any general pain. Tylenol is usually given every 4 to 6 hours, but you would follow the instructions on your bottle. Tux pads with witch hazel. So these are pads medicated with witch hazel, hence the name. Tux pads can be used for itching, irritation, or inflammation of the perineal area. Your perineal area is the area between your vagina and your anus. These pads can also be used to relieve pain from hemorrhoids. Keep in mind that these will not reduce your hemorrhoid size, they will just reduce the inflamed tissue. Lidocaine cream is a local anesthetic that will numb the skin. You could use this cream on your perineal area, especially if you tore during your vaginal delivery, or even if you have hemorrhoids, so it's going to numb that area. You could use this cream about 3 or 4 times a day. So a Sitz bath is actually a round tub that kind of fits on your toilet. You would fill up this tub with water, either warm water or cold water, whatever you think will feel good. Warm water will actually promote blood flow to the perineal area, and which in turn will promote healing, but you could also put cold water if that feels good. So the Sitz bath is supposed to relieve itching, irritation, and inflammation. You could also add Epsom salts to your Sitz bath. Hemorrhoid cream. You might develop hemorrhoids during your pregnancy, during the pushing stages, or even after you gave birth. They might be very uncomfortable, or you might not feel them at all. There are many hemorrhoid creams on the market. Again, I wouldn't get caught up in the brand names and the fancy logos. You know, just do whatever is in your price range. These creams will help with the inflammation, the irritation, the itching, and especially the pain of the hemorrhoids. Nothing will decrease your hemorrhoid size, unfortunately.
Naproxen and Advil. Naproxen is used commonly for moderate to mild pain, anywhere where your pain severity is between 4 on 10 or higher. This pain medication is commonly used postpartum for women who have either contraction-like pains or cramps when you're breastfeeding, and also for pain that is located in the perineum area where you'll have a lot of inflammation. This medication is super great to use as a little intermediate. Naproxen and Advil is commonly used for mild to moderate pain, ranging between pain severity of 4 on 10 or greater. Morphine and other opioids are commonly used throughout the postpartum phase when you have severe pain. This pain is often could be accompanied by your C-section, incision, severe cramps that are not relieved with your Naproxen or Tylenol or Advil. If you are taking morphine or other opioids, please be wary that most of these medications cause constipation, so please try to take laxatives, walk around, or use prune juice. Any fiber-inducing methods would be great to use when you're taking the morphine. Just remember, if you're taking the morphine, don't feel scared, because if you're in pain, it's better to relieve your pain than to stay in pain, and you'll be able to take care of your newborn better than you would if you were to stay in pain. Magnesium compresses, also known as Epsom salts, are used when patients have a lot of inflammation in the perineum area. It is amazing, it works super well, it is very soothing and relaxing. We recommend that you keep them on for anywhere between 10 to 15 minutes, and make sure you rinse the area really well. When I mean area, of course, the perineum area, and pat dry afterwards. A frozen pad. So this suggestion was given by one of our patients. It is amazing and it works extremely well for anyone who has a very inflamed perineal area. So what we recommend for you to do is to take your pad, put it in the freezer either overnight or for a couple of hours, and then when it's nice and frozen, you can apply it to your underwear and put it on as normal.
So we want to know what worked for you guys. What methods did you use? What worked? What didn't work? Let us know in the comments below. Thank you guys for watching. Subscribe, like, share with your friends. Thank you guys so much for bearing with us. I know we took a little long between the last video, but you know, we're busy. And thank you guys for sticking with us.
Thank you guys.